Are you passionate about making a difference in the lives of adults with disabilities? Opening a group home can be a rewarding way to support and empower individuals while also making a significant impact in your community. In this video, we'll walk through the detailed steps to successfully open a group home for adults with disabilities. Whether you're just starting or looking to expand your knowledge, this guide will provide the essential information you need. Number 1. Understand the purpose and need for group homes. Before diving into the logistics, it's important to understand why group homes are so vital. Group homes provide a safe, supportive environment where adults with disabilities can live semi-independently while receiving the care they need. These homes offer tailored support, promoting a higher quality of life for residents by helping them with daily activities, social integration, and personal development. The need for group homes is growing due to increased awareness and the desire for inclusive communities. By opening a group home, you're contributing to a broader societal goal of providing equal opportunities and dignity to individuals with disabilities. Number 2. Research and understand legal requirements. The first formal step in opening a group home involves thoroughly researching local, state, and federal regulations. Group homes are subject to a variety of laws and regulations, including zoning laws, health and safety codes, and licensing requirements. Start by contacting your state's Department of Health and Human Services or the equivalent agency. They will provide specific information on the licensing process, including required documentation, inspections, and ongoing compliance. The Americans with Disabilities Act, ADA, also plays a crucial role in ensuring that your home meets accessibility standards. Additionally, consider consulting with a lawyer who specializes in healthcare or disability services to help navigate these regulations. This legal guidance is crucial to ensure that your group home meets all necessary standards from the outset, avoiding costly mistakes or delays later on. Number 3. Develop a comprehensive business plan. A business plan is the foundation of any successful venture, including opening a group home. Your business plan should include your mission and vision, target population, services offered, and a detailed financial plan. Begin by identifying the specific needs of the population you intend to serve. For example, will your group home cater to adults with physical disabilities, intellectual disabilities, or a combination of both? Clearly defining your target demographic will help you tailor your services and marketing efforts. Your financial plan should cover startup costs, operational expenses, and revenue projections. Startup costs may include property acquisition or leasing, renovations, equipment, staffing, and licensing fees. It's essential to consider how you will fund these initial expenses and ensure sustainable operations. Sources of funding could include loans, grants, or partnerships with local organizations. Number 4. Secure financing. Once your business plan is complete, the next step is securing financing. Opening a group home can be capital intensive, so it's important to explore all possible funding options. Start by identifying potential sources of funding. These could include bank loans, private investors, government grants, or nonprofit funding. Many states offer grants or low-interest loans for businesses that provide services to individuals with disabilities. Additionally, consider seeking out partnerships with local organizations or charities that may be interested in supporting your venture. When applying for funding, present your business plan, emphasizing the social impact of your group home and the need it will fulfill in your community. Demonstrating a clear understanding of the market and a solid financial plan will make your proposal more attractive to potential investors and lenders. Number 5. Find and prepare a suitable property. Finding the right property for your group home is a critical step. The property should not only meet zoning and licensing requirements, but also be a comfortable, safe, and accessible environment for your residents. When searching for a property, consider factors such as location, size, and layout. Ideally, the home should be in a quiet, safe neighborhood with access to public transportation, healthcare facilities, and community services. The size of the property should accommodate the number of residents you plan to house, along with necessary common areas, bathrooms, and outdoor space. Once you've secured a property, you may need to make modifications to ensure it meets ADA standards. This could include installing ramps, widening doorways, modifying bathrooms, and ensuring that the home is accessible for individuals with mobility impairments. Additionally, you may need to invest in specialized equipment, such as lifts, accessible furniture, and safety features like fire alarms and sprinkler systems. Number 6. Obtain licensing and certifications. After securing your property, the next step is obtaining the necessary licenses and certifications to operate your group home. This process will vary depending on your location, but generally involves several key steps. Number 1. Application submission. You'll need to submit an application to your state's licensing agency, including detailed information about your property, services, staff, and financial plan. Number 2. Inspections. Your property will need to pass several inspections, including fire, health, and safety inspections, to ensure it meets all regulatory requirements. 3. Staffing requirements. Depending on the services you offer, you may need to hire licensed healthcare professionals, such as nurses or therapists. You'll also need to ensure that all staff members undergo background checks and receive appropriate training. Number 4. Ongoing compliance. Once licensed, your group home will be subject to regular inspections and reviews to ensure ongoing compliance with state regulations. Navigating the licensing process can be complex, but it's a crucial step in ensuring the safety and well-being of your residents. For more detailed guidance on obtaining licensing and certifications, consider visiting my website, www.millionairescoach.com. Number 7. Hire and train qualified staff. The success of your group home will largely depend on the quality of care provided by your staff. Hiring compassionate, qualified staff is essential to creating a supportive environment for your residents. Start by identifying the roles you need to fill, which may include administrators, caregivers, nurses, and support staff. Depending on the size of your group home, you may also need specialists, such as physical therapists, occupational therapists, or counselors. Once you've identified your staffing needs, begin the hiring process. Look for candidates with experience in working with individuals with disabilities, as well as the necessary certifications and licenses. Conduct thorough background checks and interviews to ensure that you're hiring trustworthy, competent individuals. Training is equally important. Ensure that all staff members receive comprehensive training on the specific needs of your residents, including communication techniques, behavior management, and emergency procedures. Ongoing training should be provided to keep staff updated on best practices and regulatory requirements. Number 8. Develop policies and procedures. Establishing clear policies and procedures is crucial for the smooth operation of your group home. These should cover all aspects of daily operations, including resident care, staff responsibilities, safety protocols, and emergency procedures. Start by developing a resident care plan that outlines how you will meet the individual needs of each resident. This plan should include details on medical care, personal care, dietary needs, and social activities. Additionally, develop procedures for medication administration, record keeping, and incident reporting. Your policies should also address staff responsibilities, including job descriptions, schedules, and performance expectations. Safety protocols should cover fire safety, emergency evacuations, and infection control measures. Finally, establish a system for monitoring and evaluating the quality of care provided in your group home. Regular reviews and audits can help identify areas for improvement and ensure that your home remains in compliance with all regulatory requirements. For assistance in developing comprehensive policies and procedures, visit my website, www.millionairescoach.com, where I offer customized coaching and resources. Number 9. Market your group home. Once your group home is ready to open, you'll need to market your services to attract residents. Effective marketing is key to ensuring that your home operates at full capacity and reaches those who need your services. Start by creating a marketing plan that outlines your target audience, key messages, and marketing channels. Your target audience may include potential residents, their families, healthcare providers, and social workers. Create a professional website that showcases your group home's mission, services, and unique features. Include testimonials from residents or their families if possible, as these can be powerful tools in building trust with prospective clients. Utilize social media to connect with your community, share updates, and engage with potential residents and their families. Additionally, consider partnering with local healthcare providers, social service agencies, and advocacy groups. These organizations can refer potential residents to your group home and help spread the word about your services. For personalized marketing strategies, visit www.millionairescoach.com, where I offer targeted coaching and resources to help you promote your group home effectively. Number 10. Open your group home and continuously improve. With everything in place, it's time to open your group home and welcome your first residents. But the work doesn't stop there. Continuous improvement is key to the long-term success of your group home. Regularly solicit feedback from residents, their families, and your staff to identify areas for improvement. This feedback can help you make necessary adjustments to your services, policies, and procedures. Additionally, stay informed about changes in regulations and best practices in disability care to ensure that your group home remains compliant and provides the highest quality care. Building strong relationships with your residents and their families is crucial. Regularly communicate with them to keep them informed and involved in their loved one's care. This can help build trust and ensure that your group home is meeting the needs of your residents. Opening a group home for adults with disabilities is a challenging but incredibly rewarding endeavor. By following these steps, you'll be well on your way to creating a supportive, caring environment where your residents can thrive. If you need